Good afternoon and welcome. I'd like to thank everyone for coming out in this cold afternoon to send a message, a really important message to our governor and to Albany. I'm Andrea DeMeo. I'm president and CEO of Trillium Health. Joining me this afternoon are Trillium staff, our patients, board members, and health system leaders from the URMC, and Rochester Regional Health, and community service organizations. And together we're here to implore Governor Hochul to stop the 340B Medicaid carve-out. What she has proposed in her budget and is planned to go into effect this weekend will impact those we serve at Trillium Health and impact our community as a whole. And those who will be harmed are the people and our children who rely on Medicaid for their health insurance. We have seen firsthand health inequity play out during COVID. Many of our Trillium Health services were essential to addressing the gap in both testing and vaccine. We rely on 340B income to run such programs as our mobile access clinic, our intensive HIV prevention and testing service, and care for people with opioid dependence. We are calling on the governor to do what is right and what is just, and keep the 340B in Medicaid managed care to allow us to keep our programs and much needed services intact. At Trillium Health, we believe that everyone who walks through our door deserves high quality, affordable health care, regardless of income, sexual orientation, gender identity, race, or ethnicity. And we need the 340B program as it was designed and as it was intended to support services for our most vulnerable. These dollars are not intended for the state's coffers. Without managed care, Trillium Health would lose millions in program income. Although the state professes that it will not let safety net providers fail by offering a make-whole fund, there is no transparency on how these dollars would be attributed to each provider. There's no guarantee on how it would be sustained or how it would allow for growth as we address the need for access to prescription medications for all. Access to prescription medicines is critical to address health issues. We need to know and we need answers. But it doesn't have to be this way, and it's not too late. The governor has the power to save the 340B program. The governor can provide leadership for her state. She can agree to a repeal of the 340B Medicaid carve-out or pass a common-sense compromise legislation that's been introduced by Senator Gustavo Rivera and Assembly Member Amy Paulin. We're extremely grateful for the support from Assemblyman Harry Bronson, who has led the way, our other Rochester delegation members, Assemblypersons Sarah Clark, Jen Lunsford, and Demon Meeks, and Senators Jeremy Cooney and Samara Broke, along with other state lawmakers who have stood by our side. We're also grateful for the support of Rochester City Mayor Evans, County Executive Adam Bello, Greater Rochester Chamber of Commerce President and CEO Bob Duffy, and many others for their voices, as this change will impact so many who live in Rochester. The clock is ticking. We need the governor to do the right thing. And now I'd like to turn the podium off to Peter Robinson, Vice President, Office of Government and Community Relations at the University of Rochester. Peter?
Thank you very much, Andrea. I mean, we're here in front of Trillium Health for a reason. The programs that the 340B funding provides support for are based here. They're based at Jordan Health Center, and they're based in the health systems in this community. In total, the 340B program through Medicaid captures $100 million in pharmaceutical discounts and provides that money to our programs here in this community. This carve-out that is being proposed by the governor and likely to take effect on April 1st will take those dollars and remove them from our community. These are not state dollars. These are coming from pharmaceutical company drug discounts. And this seems to me the best way to provide care for the kinds of programs that are so essential. Those that Andrea outlined here at Trillium, For us, it involves cancer care, behavioral health care, the Children's Hospital that is so vital to all of us in this community. All of those programs are supported by 340B. I want to reiterate how grateful we are to the support of our legislative delegation, to our county executive, and to our mayor for advocating for us. The one House bills that have been passed in the legislature actually call for the carve-out. We want the governor in the legislative negotiations to accept those proposals and eliminate this carve-out now. So we are calling on the governor to compromise and support what the legislature is proposing. So I thank you very much, and I'll turn it back to you.
Thank you, Peter. Thank you, Peter. And sometimes it's best to hear from the people who are closest to the patients that we serve each and every day, or perhaps are a patient themselves. And I'd like to invite Eden Clark, who's a client and patient of Trillium Health, and also one of our Trillium Health team members. Eden?
Good afternoon. My name is Eden Clark. I am both a client and employee here at Trillium Health, and I am transgender. The services and career opportunities that Trillium Health have provided for me have greatly improved not only my health, but my entire quality of life. Trans people in the United States have constantly been under attack by legislation seeking to undermine our well-being at best and outright kill us at worst. The ACLU.org currently lists 431 different bills across the country targeted towards the rights of LGBTQ+ people. Historically, New York State has been a safe haven for my community, but the proposed cut to 340B threatens to deny critical funding that health centers statewide need to provide comprehensive and affirming care to us. I requested fellow members of the trans community here in Rochester to share their experiences at Trillium Health with me. These are just a few of those sentiments. They've been really helpful and supportive when I haven't had insurance, and have even provided a food bank and such for when I need it. I've never gotten to see medical professionals who shared my lived experiences so much, and I feel like the care I've gotten there has been so much better for it. Their payment system is really lenient, and I never feel I'm in danger of losing access to health care with them. Trillium is literally the only place that has made transition and gynecological care feel accessible to me. They enabled me to find necessary care I'd been avoiding due to cost and dysphoria. This level of patient-centered care would simply not be possible without access to 340B pricing. So I beg you, we cannot allow necessary resources to be pulled away from those most vulnerable in our community. All for the sake of saving the state money. Thank you.
340B indeed. And now I'd like to invite Herminio Rodriguez, a member of our pharmacy team, to share a few thoughts with you.
Hello everyone, my name is Herminio. I'm saying the speech in Spanish. Buenas tardes, mi nombre es Herminio. La decisión del Estado de Nueva York de implementar esta política, de eliminar 340B, es una desinversión directa a la comunidad que ya lucha contra muchos obstáculos. Los cortes a estos fondos amenazan con afectar los servicios que comúnmente son accesibles a nuestra comunidad. Estos servicios de salud han mantenido nuestra comunidad saludable y con mejor calidad de vida. Algunos de los servicios que se verán afectados son servicios de farmacia, servicios de salud, servicios de nutrición, servicios de transportación, alimentos y muchos más. No podemos resistir otro azote más en nuestra comunidad, en nuestra calidad de vida. Su apoyo es crucial para la campaña de mantener 340B. Sin su apoyo, los servicios que usted recibe comúnmente se verán afectados y no serán accesibles a nuestra comunidad. Por favor, necesitamos su apoyo. Es urgente. Thank you.
Thank you, Herminio. And then last, we'd like to hear from Mark Malahusky, our Vice President of Pharmacy, who's been very active to help us save 340B. Mark?
Wow, that's some tough acts to follow, guys. Thank you so much, really. Okay, so I'll try to wrap us all up here and give you a little bit of a history. In 2020, Governor Cuomo passed a budget that would allow New York State to take 340B funding away from safety net providers, which is known as the Medicaid carve-out. Safety net providers such as Trillium, Jordan Health, University of Rochester Medical Center, Rochester Regional, just to name a few here in Rochester. Now, that budget was signed into law, and the changes were scheduled to go into effect on April 1st of 2021, so for 1 year later. However, during that year, thanks to extensive lobbying and advocacy from several statewide coalitions, the Medicaid carve-out was delayed for 2 years with the idea that stakeholders could come together to develop a compromise without destroying the healthcare safety net. That deadline is quickly approaching. In fact, it's this Saturday, April 1st. First of all, on Saturday, when does the government do anything on Saturday? You don't have to pay your taxes on Saturday, and they're doing this on a Saturday. Crazy. Anyways, so Governor Hochul's executive budget is going to allow the Medicaid carve-out to go into effect just as planned. However, both the Senate and the Assembly have rejected her proposal in their one-house budgets. The Assembly's budget called for a full repeal of the Medicaid carve-out. The Senate's budget called for the passage of a compromise bill that Andrea mentioned earlier that was introduced by Assemblymember Amy Paulin and Senator Gustavo Rivera, which will achieve the state's policy objectives, avert disruption, and most importantly, preserve the safety net. And additionally, it will save the state money. Both houses were loud and clear. The carve-out is a bad idea. Now, the final state budget is going to determine ultimately the future of the 340B program here in New York and the fate of safety net providers across New York State. As Andrea mentioned, we have had tremendous support from Assemblymember Harry Bronson and all the members of the Rochester delegation and state government. They all co-signed the compromise bills in both chambers of the legislature. And we are so grateful for their unwavering support and their relentless advocacy. Oh boy. Okay, a bull in a china shop. Now we're calling on the governor to stand up for vulnerable communities across New York State and save the safety net. Now, are there any questions here for any of us, any of the folks that spoke? Questions? Okay.
So as we finish or start our rally, just a couple of words we'd like to say to the governor and to Albany. Let 340 be. Thank you.
Repeat after me. 340B saves lives. 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 Save our safety net. Save our safety net. Save our safety net. Save our safety net. A little bit louder, I can't hear you. Save our safety net. 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 Healthcare is a human right. 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 Save our safety net. 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 Healthcare is a human right. 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 Save our safety net. 340B saves lives. 340B saves lives.